Hey guys, Dr. Dave here, Pittsburgh Upper Cervical Chiropractic. This talk is titled Wait Until It Gets Worse, and Then We Can Treat It. So, as silly as that may sound to you, this is something that I've actually seen quite often in the practice, in the office. I remember a couple years ago I had a patient that, consulted his primary care doctor for some neck issues that he was having, some neck pain, and he was concerned about it getting worse. And so the doctor basically recommended, taking some over-the-counter pain, medications to help with the pain, and then to revisit it in another 6 months or a year. And at that point, it'll probably be bad enough that they can go ahead and do some sort of surgery or something a little bit more invasive. And that was obviously very frustrating for that patient to hear that. And I get frustrated because I hear that actually quite a lot is, let's just wait until it gets worse and then we can do something about it. There are options now where you can actually be very proactive in your health to either help to kind of keep it at bay, to stabilize it, keep it from getting worse, or maybe even show some improvement. Now, this patient that came in was very, very skeptical about the type of work we did. He had been to chiropractors before, and chiropractic care was helpful for some of the things he did. But when we were telling him, hey, you know what, we're going to help you out by just adjusting this one bone right up here, the atlas, he was a little skeptical. And once he got adjusted, though, he started to see the results. In fact, now we are 5, 6, 7 years, since starting care, and didn't have to go down the route of surgery. And surgery has its risks. So if it can be prevented, we can do that. And not to mention that, no pain relievers, no neck pain. We've actually seen stability occur in the neck, and then just feeling good and being able to go about doing everyday activities without the concern about maybe possibly having some chronic debilitating issues that can occur either just from letting it go until it gets bad enough to treat or even after surgery. Now, what about other things? I hear often, usually from patients, or if I'm listening to, people talking at different gatherings and things like that, they'll say, yeah, my doc says my HbA1c, which is the when you test your blood to see if you're, considered diabetic, my HbA1c is good. But when they discuss their levels, they're good, meaning they're at the high range of good, meaning that perhaps the next time they get it checked, it's going to be high and they're going to be qualified as either pre-diabetic or diabetic, which means that they're going to be put on some medications or some things like that, and potentially things could get worse from there because of having unregulated high blood sugar. Or the same thing with borderline, normal high cholesterol, borderline normal high blood pressure. All these things actually have options that someone can go in and do. And some of that means making dietary changes and modifications. Some of that means, getting and doing some more exercise. And sometimes that also can include, getting some sort of specific chiropractic care to kind of help that process as well. So the point of this is you don't have to wait until it gets worse to treat it. You can get started right now, today. You make the decision, I want to get well, I want to improve my numbers, I want to get out of pain, I want to get out of the chronic cycle. Because whatever you were doing yesterday, last week, last month, last year, clearly is not getting you to the point where you're going to be better in the next week, month, year. So you need to make some changes, and you can make those changes. Sometimes you just need a little help. If I can help in some way, please feel free to reach out. I can at least point you in the right direction if it's not me directly. But get out there, do something about your health, make it better, because you owe it to yourself, you owe it to your family, and your kids will thank you for it. Anyways, hope you have a great day. Take care.